Hello and welcome back. Thank you for tuning in to Note to Pharm.D. My name is Kenya, and today I'll be going over some standards and regulations as it pertains to sterile compounding. Again, if you are like me, I am a New York State licensed pharmacist. I will be sitting for my board certification in sterile compounding this spring, and I've just decided to utilize my YouTube as a study technique. I'm hoping that anyone else like me studying for the same thing can benefit from this, or I'm also hoping to shed some light on this area of pharmacy. So, for our objective today, we'll be discussing the standards and regulations relevant to sterile compounding. First, before we dive into that, let's differentiate the two. When referring to compounded medications, standards describes the minimum requirements needed to be considered compliant with said standard. And regulations would describe best practices to provide guidance to pharmacists compounding these medications. The major difference between the two is from a legal standpoint, compliance with standards are mandatory, whereas compliance with regulations are optional. When creating these standards, there's an elected council of experts in charge of scientific decision-making body of the USP, United States Pharmacopoeia. Then, to the bottom left of this slide, you have the expert committee that address specific standards within the USP. These experts in particular are responsible for USP 797 and USP 800. Now, these are the two standards that pertains to sterile compounding. I don't know if you remember before in my other video, USP 795 pertains to non-sterile compounding. And the difference between USP 797 and USP 800 is the hazardous drug component of USP 800. Now, continuing on with this topic, expert panels, bottom right hand of the slide, provides additional expertise on a focused topic. Now, it's important to note that every standard undergo a period of public review and comment. For example, the USP 797 2021 underwent revisions in 2015, 2018, and as well as 2019 prior to being enforced this coming November of 2023. So that's a few years of revision, gathering the public opinion, and it's important that us pharmacists, keep a lookout for these organizations asking for our review because we are the ones that's going to be using these standards in practice. Now, jumping into some regulations pertaining to sterile compounding. Now, this is a good one. If you are a pharmacist that works in the hospital healthcare system, you would see these two sections be brought up a lot. So, the Federal Food, Drug, and Cosmetic Act, they have Section 503A and 503B. 503A pharmacies being traditional compounding, and 503B pharmacies being classified as outsourcing facilities have different requirements, such as who may compound, what may be compounded, and quality standards. What's important to understand is that 503A compounding is patient specific and would require a prescription, whereas 503B compounding does not. A perfect example of a 503A pharmacy scenario would be a pharmacy that prepares TPN being total parental nutrition. So, due to the complexity and labor for preparing parental nutrition, many hospitals contract with 503A pharmacies to fill their TPN orders. A 503B pharmacy, on the other hand, would be a pharmacy that have the personnel and equipment to compound multiple batches of an IV piggyback or a large volume piggyback or or operating room syringes with extended BUDs, BUDs being beyond use states. The disadvantage that many hospitals face is the limited personnel and equipment to perform the required sterility tests to extend their compounded medications, which results in batching said item more frequently. So, for example, if your pharmacy have to batch a fast mover like vancomycin 1.2 grams in 500 ml of normal saline, this particular item might expire in 10 days under refrigeration rather than 60 or 90 days if obtained from a 503B entity. Another point to note is 503B entities must be registered with the FDA and renewed annually. So you can pause here and take a scan at the table here that lists all the notable differences between the two. I won't go through all word for word. So moving on to OSHA regulations. These regulations are more geared to ensuring that employees are working in a safe environment. The Title 29 of the Code of Federal Regulations goes into personal protective equipment, eye and face protection standard, respiratory protection standard, access to employee exposure medical records, and hazardous communication standards. And lastly, the Environmental Protection Agency, they design and characterize hazardous waste. So this regulation would help you classify and also communicate to your staff where and how to dispose of hazardous waste. To conclude, I'm hoping this conclusion slide is helpful to tie everything in. I know I started off without the conclusion slide, but I think this might be necessary. I don't know. Let me know in the comments below. But to conclude, standards relevant to sterile compounding are created through an expert committee and undergo extensive review prior to being enforced. Regulations set the guideline for best practices, and it's important to note the differences between the 503A and 503B sections of the FDCA. So if you are sitting for your boards, I would say these three points here, you should pay a little bit close attention, expand your knowledge more in these areas so you're familiar with, any question that might come at you. Thanks again for tuning in, and please don't forget to comment, like, and subscribe to my channel for weekly pharmacy videos. Until next time.